This is my first time doing a live ever, so sorry if I'm not doing it right. Just bear with me. I put a question box on my stories yesterday, and I wrote all your questions down. So I have Dr. Leathem here with me and Nurse Marilynn. They will be answering all your questions. And if you guys have questions as we're going, just type it out and I will ask them. All right, so yeah, here we go. Let me flip this around. If I know, oh, right here. There we go. Okay, hi guys.
Hello, Instagram world.
Do you guys want to introduce yourselves?
Yeah, I'm Dr. James Leathem. I'm a board-certified anesthesiologist, one of the co-founders of Advanced Wellness and Pain. My other two co-founders are Dr. Wong, Dr. Sharma. We've been doing ketamine infusions since 2020 in a mental health, clinic type setting. It was our COVID pivot, and so we're all board-certified anesthesiologists that made the transition from hospital-based anesthesia to our two clinics. One's in Scottsdale and one's in Gilbert. And then Marilyn's one of our amazing nurses that works with us in our Gilbert location. She's been with us for a couple of years.
Hi, I'm Marilynn. Been here for 2 years, nurse for 11 years. I have been through treatment here and love it, believe in it, and I think it's amazing.
This is transformational medicine. That's how we do approach it. We do approach ketamine as a psychedelic as well. We'll probably get into that, but that's really important because just know that ketamine clinics out there, it's like the Wild West right now. Everyone does it differently. And so you want to be able to just go do your due diligence, talk to the clinics, visit in person, and just really kind of see what you're getting. Because they are all different, even though it's the same medicine, it's dosed differently. There's different supportive care as far as integration. Sometimes you have anesthesiologists, sometimes you don't. And so we're here to kind of demystify some of that for you today.
All right, so let's get into these questions. First one, can you explain what ketamine therapy is and how it works in the brain?
Cool, so we call it ketamine-assisted therapy because ketamine's not the main therapy. It's assisting the therapeutic process. And so ketamine is really inducing something called neuroplasticity, which is the brain's ability to rewire itself. And so ketamine is a dissociative anesthetic, so separation of mind and body. And then we do approach it as a psychedelic medicine. It's working on something called the NMDA receptor, N-methyl-D-aspartate. And so that receptor, we're an antagonist to it, so we're blocking it. And we block that receptor at subanesthetic doses. We're actually getting an increase in something called glutamate, which is your brain's most abundant excitatory neurotransmitter as a human. And then that is then acting upon something called the AMPA receptor. And that's then inducing neuroplasticity via the release of something called brain-derived neurotrophic factor, or BDNF. And that's the currently held belief on how ketamine is working so robustly and rapidly to induce the neuroplasticity and get you unstuck, right? As a human being, we have between 40 and 60,000 thoughts every single day. The problem is they're about 90% the same day in and day out. And so ketamine is giving you that reset, that mental reset essentially, and gives you that chance to really kind of reframe your mind, reset, rewire. And then when you're doing integration coaching on the days before and after your infusions, so you're then taking that experience that you had here in the clinic and then trying to apply it to your life to really create change and get durability versus just relying on taking a medicine, say like a SSRI, like a Zoloft or a Prozac. That's really like a Band-Aid approach. Ketamine, we're trying to get you to that root, that core, so you can actually heal and then transform your life. I really approach that you are the medicine. What's the first two letters in the word medicine? It's M-E. It's you, it's me. It's me versus me. It's you versus you of yesterday, essentially. So we do approach it as a psychedelic medicine, but that's essentially how we do approach it, integration coaching, infusions in the clinic, and then Marilyn's also doing the infusions with us as well. Do you want to expand on that as well?
Yeah, so I'll just say this. All of that is like very scientific way of saying it helps you change your perspective.
100%.
So what all that does, I can translate into how it feels in my mind. So I was somebody who struggled with suicidal ideations, who struggled with depression, anxiety, most of my life because of trauma as a child. And after I did ketamine, I had never felt a sense of seeing my perspective change. I always say after my first treatment, it was like a vacuum sucked me out and I could see the bigger picture for the first time in my life. And that's what it did in my mind. It like quieted things down and it gave the trauma perspective.
Yeah, it gives you space. So I said ketamine can help you get into your mind so you can get out of your head. Also, I'll give people the analogy that imagine all your problems as the thumb right here. Close your eye. This is what it feels like when you come into ketamine the first time. All your problems are really at the forefront of your mind, is blocking your ability to see the world in any other way. And then ketamine just does this. It just moves them out. I just gave you the bigger picture and shifted your perspective, essentially.
Yeah, I think that's a really great way to explain it, because you told me that when the first day I saw you, and someone asked me the other day, like, what is it? You know, and I don't know the science behind it and all that, and I explained that to them. I was like, it really does. Like, it just kind of, your problems are still there. Mm-hmm. They're just not as big as you thought they were. So, that's a really good way.
Shift in perspective, that's the key. It's the lens through which you view yourself in reality, and your thoughts dictate your reality. Whatever you focus on expands, and it gives you the ability to change your focus and shift and give you space, you know, from those traumas. Like, what is a trauma? It's a memory. And so then what is a memory? Well, it's neural circuits that are still firing and wiring. Ketamine will help you to change those neural circuits, essentially. That's where it's working, at that neuron level.
Yeah. Okay, this one is, what mental health condition is ketamine most commonly used to treat, and how does it differ from antidepressants and talk therapy?
Want me to jump in?
I mean, I can say it from my perspective. For me, like I said, I had suicidal ideations. I've never had another suicidal ideation from the very first treatment. It completely broke those ideations, and I believe it's because it drastically shifted my perspective. Like, there aren't problems in the world that are big enough for my life to end. Like, that just changed for me. It treated my depression, secondly, better, like, than any SSRI. I've been on every one of them, or a bunch. And some of them worked, and I believe they were good for a season. And it lastly treated my anxiety. Anxiety is more things that haven't happened yet, so that's a harder one to kind of get to the root of. But for me, suicidal ideations was huge. Just in that alone made it worth it for me, because, you know, that's a very painful place to live. And that completely changed it.
Totally agree with you. Yeah, ketamine is the most rapid acting anti-suicidal agent in all of medicine. Nothing even comes close. Sometimes even the first infusion can break you out of those suicidal ideations. I would say personally, in our experience, we've done over 10,000 infusions now between our two clinics since 2020. The number one thing I think ketamine does work best for is PTSD. Number two, I'd say depression. And number three, anxiety. It's rare that they all are going to happen in a vacuum and isolated. It's usually multifactorial. Other things is that ketamine is actually being used off-label to treat these mental health conditions. So the ketamine we use in the clinic, it's known as racemic ketamine. So it's 50% R isomer, 50% S isomer. The ketamine in that application is off-label to treat mental health conditions. So we can't say that that's FDA approved to treat any of those things, actually. There is a S-ketamine, Spravato, that is approved for suicidal ideation as well as treatment-resistant depression, and has been recently approved for monotherapy as well. It used to be that you had to be on SSRIs or antidepressants and maybe failed some of those to then get access to Spravato, but that has changed somewhat recently. And so really we would look at the patient, you know, as an individual. We do in-person consultations first, completely for free, assess your situation. We're going to do different survey scores. So we're going to look at things somebody has the GAD-7 to look at anxiety, PHQ-9 for depression, PCL-5 for PTSD. We're going to do an ACEs score to look at any childhood trauma, and then the SSRS to check for suicidality. And then based on looking at that picture and trying to quantify your feelings, then we're going to come up with a treatment plan for you. So, you know, I know Adriana has a question here, so we're going to let her jump in.
We have a question. Do you need a referral from a main physician, or how do we go about it?
Yeah, you do not need a referral from another physician. You can self-refer, because then us as physicians will assess you and decide if treatment is with ketamine is appropriate for you. And so you don't need it, because it's actually not covered by insurance. This is all cash pay. And so we don't have to have that, you know, that barrier essentially to entry, having to see a primary to then refer you over to us. And then we can assess you as anesthesiologists if the treatment is appropriate for you.
And I'm going to jump to another question I have here since you're on the topic of insurance. The question is, does any insurance at all cover it, or do you see a future of insurance covering ketamine therapy?
Yes, so IV ketamine infusions, it's deemed experimental by the insurance companies, so they do not usually cover it outright. What we can do is give you something called super bills, and so we can give you these different diagnosis codes, and then you could submit those to your insurance carrier. Now, it's only going to be commercial insurance, things like Blue Cross, United Healthcare, Aetna, things like that. Medicare, Medicaid will not reimburse whatsoever, and it's very variable because there's a lot of different plans inside of those major insurance companies. Some will give you partial reimbursement, maybe a few $100s per infusion, and some might give none at all. So there is that direct out-of-pocket cost initially. We do offer financing though through a couple of different companies to try to make it more affordable. We're definitely sensitive to the fact that it is a substantial investment in yourself, but what's the cost of not getting better and letting your life pass you by? It's really priceless. So ketamine, the Spravato, is covered by insurance, of course, if you've met your deductible, and a lot of people have very high deductible plans. So know that you might be a few $1,000s out of pocket before that ever even kicks in as well. And so it's important just to call your insurance company, check with them, but generally IV ketamine is not covered by insurance.
And someone here said, what is the cost for the ketamine therapy?
So it's it varies, widely from clinic to clinic, state to state. It also depends on what treatment program we would advise you to do. Some people maybe have gone to other clinics and maybe they just want to do booster infusions with us. So that would be a different price. Maybe some people don't have anxiety, depression. They just want to access a psychedelic medicine in a controlled environment with professionals. They might do a 3-infusion program. That's different. Generally, for someone that has PTSD, depression, anxiety that's labeled as treatment resistant, they're on a host of other medicines, we will generally recommend a 6-infusion course with 3 hours of integration coaching. And then we also have a workbook. So this is a program here at our clinic. It's not just treat them ketamine where we're giving you medicine and saying, figure it out on your own. So we also do offer discounts for veterans, healthcare providers, first responders, that kind of stuff. Generally, you're looking in the $2,000 to $4,000 range, and there generally is maintenance with this as well. So it does vary. So it's hard to give you an exact price because there's some variability there, but generally you're looking around $2,000 to $4,000, maybe even $5,000, state to state, clinic to clinic. So call us. We do free consultations in person, and we can come up with the right treatment plan for you and give you a more specific price.
But I would say in perspective to mental health treatment as a whole, it's on average costs. If you talk about going to a therapist, it's usually about $150 an hour, and you're doing that weekly, or at least every other week. So to me, I tend to look at the bigger picture of the cost rather than the just isolated, don't get scared by the tag price of it. It's if you think about how much you spend on your mental health in over a year or 2 years. I was in talk therapy for straight probably 3 or 4 years and paying $150 a week.
It's definitely an investment in yourself. I'll also tell you what's the most expensive ketamine infusion. It's the one that doesn't work. And so I can give you a guarantee at our clinic, you will not get worse. You will only get better, or there will be no change, but you will know if ketamine was something that will work for you. But it is definitely, a few $1,000s investment in yourself. But that's really priceless if you get your life back.
And then someone said payment. Can you do payments? Can you make payments?
100%. Yeah. So we offer, there's 3 different companies. I'll just let you know. So one's Care Credit. You can literally just go on their website online, carecredit.com. There's also Advanced Care Card. Those are the 2 ways in which you could access ketamine, where it does a background credit check. I think over a 580, you can usually get 0% interest for about 12 months or so. So that really kind of breaks it up. And then we do something called Patient Preferred. Does not go off a credit check. It goes off basically your bank account balance. That will start accruing interest though day one. It's in the lower percentage range, under 5%, and then it will grow over time. But that does break it up. We don't do the payment plan with you. You would do it with one of these third-party companies for sure.
Okay. Yeah, Louise said that would be great, the payment plan. I did the payment plan, guys, and it is great, and it is 100% worth it, I will say. Okay, so next question here. Can ketamine treatment help with PTSD from several decades ago?
Yeah, so if the PTSD is still something that you're reliving, right, you're firing those neural circuits, then the ketamine can help kind of shift the way that lives within you. It really comes down to how much is it affecting you in the present moment. Sometimes it's hard to know that. So it can help with that. If it's something that happened recently, probably the sooner you kind of access the ketamine relative to the event, the more likely we can cause a rewiring. But yeah, I would say, generally speaking, PTSD from several decades ago could still help with that, especially if it's still affecting you today.
Well, I feel like I can definitely speak to this. I have an ACE score of I want to say it was 9, I believe, 8 or 9. So pretty high up there. Had a lot of childhood trauma, and that affected me as an adult. It triggered me in ways that I didn't even know it would. It would come out in relationships and friendships and just all of this trauma from a child, all this rejection from a child, deeply affected my relationships. And I can tell you with 100% certainty that ketamine has changed that. Now, is it the actual medication? Yes and no. It helped me change my perspective. It helped me see life from a different way. It helped me get out of my own way and not process everything through the trauma. But it also helped me realize that I was processing things through trauma and that these weren't real feelings and emotions. And it helped me, like, for the first time, be able to feel pain without being overwhelmed by it, without getting that feeling of like, I can't breathe because this is so painful, I'm not gonna be able to handle it. I could disassociate, work through all that pain and come to terms with it and put it to bed. And then it didn't affect my relationships. It wasn't coming out unknown to me because I had suppressed it or was in my subconscious. So yes, I do believe it works for even way past traumas from a child.
Yeah, you got to feel it to heal it, and know that a lot of the antidepressants are more just numbing agents. They're band-aids. Ketamine, it's work. It's a mental marathon in there, and it's not necessarily that the trauma is going to come up in the infusion. It's that it's still helping to rewire. You know, how are we experiencing life? Okay, just think about this. We have over 80 billion neurons in the adult human brain. That's where life is actually happening. We can change those neural circuits. We know that. You get something called global connectivity when you access a psychedelic medicine in a controlled environment like this. So you're literally changing the circuits, the neural circuits that are firing and wiring, and get you unstuck from your trauma. So the memory is still there. I can't take away the memory, but I can take the bite or the sting out of it, and now it's more of a neutral feeling. So it's like, yeah, that past does not define me. That past was here to refine me, and I do remember that event happened. But when I now think about it and access it, I'm not as the same emotional, person that I was, before the medicine.
Like even now after boosters, I will go home and I will think and sit with some of the more painful experiences and memories that I have, because somehow it like removes the power from it, because you are able to kind of process through that pain without being overwhelmed by it. So I could, as before, I couldn't sit with those emotions. I couldn't sit with those feelings that like the reality that, hey, I wasn't loved the way I should have been as a very small child. That's extremely painful. That's extremely overwhelming. But after ketamine treatment, I can sit with that and I can heal with that and I can have a different perspective of this doesn't define me. And so it's very, very healing for PTSD.
Yeah, the thing I would say is that we have a workbook that has a lot of equations in it, and the saying goes like this: it's trauma plus healing equals wisdom. In short, no rain, no rainbow, no mud, no lotus, no pain, no gain. I don't make the rules of life, I'm just an interpreter. But if you can take your trauma and heal it, it's an opportunity to gain wisdom in this life. And that's what this incarnation partly is all about, is gaining wisdom, learning lessons. I know you cannot take this body with you if there's an afterlife, but here's my question for you, is can you take the wisdom with you? Can you take the lessons? Because if you can, then you want to heal those traumas while you're here. That's part of our reason for, this is Earth School. This is where we heal our traumas and learn our lessons.
And I will say that it does definitely, this might have been your experience too, Adriana, it does definitely help you to have more grace on yourself and have more perspective on yourself.
Yes.
You can have a clearer understanding of why you are the way you are and grow and change from that. So it's not just like, oh, I'm a victim. Like you can recognize you're a victim and not stay there with it. It gives you a good perspective. It's really hard to say that unless you've experienced it, but it really does help you to accept the past but not be defined by it.
Yeah. I think that was one thing I told, I don't know if I saw you after my first session, but after my first session, a lot of my childhood trauma also came up, and it was like an out of body experience of me seeing myself as a child being sexually abused. And after the session, I just remember thinking oh, that was not my fault. It kind of gave me my power back. You don't have this over me anymore. You were wrong. This was not my fault. This was your fault. So it kind of it gives you that power back, and it just makes it just shifts that whole thing.
It totally changes
Yeah.
the perspective
Yeah.
of the trauma.
Yeah.
Like it does. It makes you see it clearly,
Yeah.
basically.
Yeah, so they, you know, and it made me feel like, oh, like they no longer have this control over me.
Yeah.
Like, sounds weird to say, but like that is, it does just shift your mindset completely.
100%.
Yeah, which is amazing. Okay, let's do this question. Does it help for fear as well? I suffer from extreme fear, and when I get stressed, I start feeling like numbness and fogginess, and it gets worse. I worry about everything, and it affects my life so much.
You want to jump or me do it?
Sure. I mean, I will say this, like, I think anxiety manifests itself in many different ways, and it's different for everybody based on their experiences. Sometimes it can be debilitating fear, and I can definitely relate to what that feels like. You know, I have a debilitating fear of rejection. I have in the past. It, like, very debilitating. And so it does help with that a lot. But more, anxiety is hard because it hasn't happened yet. It's fear of things that haven't happened yet based on our experiences. And so for me personally, it has helped my anxiety in the way that, so I don't like come out of a treatment and say I don't have any anxiety anymore. That's not how it works. It has helped me, and maybe it does for some people, but for me that wasn't my experience. I come out of a treatment and I guess, okay, I don't like the word empowered, but I feel empowered over my own mind. Like I can take control over my mind.
Yeah.
And that my mind doesn't have to control me, or my emotions don't have to control me. It helps me to say, like, so I always say this, I lived in a very negative place for most of my life because of my experiences. And I used to say, like, I'm real, I'm not negative, I'm just real, and I like to see things for what they really are.
A realist?
Yeah, I'm a realist, I'm not negative.
Yeah.
But really that was just a defense mechanism, way for me to protect myself. And so ketamine treatment helped me to see things in a positive way. And I always say this to Dr. Leathem, before I even had a treatment, on my very first day of work here, and they didn't even really know how messed up I was then. Like, they really didn't. I covered it really, really well. He said, life isn't happening to you, it's happening for you. And that blew my mind. Like, I know that sounds so simple, but it was such a life-changing thought process to me. I lived in a place of, like, I can't catch a break. Everything's always happening to me. Everything's like, if it's gonna go wrong, it's gonna be me. Like, and I lived in that place. So now I don't live there. Like, yes, of course I have negative thoughts. Yes, I have bad feelings. I have insecurities, but I don't live in this constant negative place. That's not my normal. So when those negative thoughts and those anxious thoughts come up, I recognize them so much sooner, and I'm able to speak truth to them, speak reality to them, and back them up with facts in my own mind. So that's how it has helped my anxiety and my fear, because I catch it, I recognize it sooner. It's not my normal. I don't live there in that negative, fearful place every single day. When those thoughts do come up, and they do come up, I can say, okay, that's negative, that's fearful. Where is it coming from? Let's get rid of it. A lot easier than I could before.
Yeah, I agree with Marilynn, looking at fear as kind of a form of anxiety. So usually we'll say fear is like really an acronym for false evidence appearing real. And so in your conscious mind, you're experiencing that fear, but ketamine gets you in touch with your subconscious mind and your unconscious mind. And so there's a saying, this quote from this guy, Dr. Carl Jung, and is, until you make the unconscious conscious, it will direct your life and you will call it fate. And so is that fear coming from that subconscious mind to the conscious mind and then directing your life, right? Just like you talked about the universe kind of conspiring for you, that's like a state of paranoia. Well, there's also a thing called pronoia, that is actually the universe is conspiring for me. And so it's just as likely that that good thing's gonna happen as that negative thing's gonna happen. The thing is, your brain is a prediction machine. It's a prediction organ, and it thinks that the past is a prediction of the future. And so if you've had trauma and challenging things happen to you in the past, it then thinks, yes, that's gonna happen to you again, right? Because your ego is your learned identity of self, and your ego would rather keep you in a familiar hell than allow you to move into an unfamiliar heaven. And once you start to reveal these things to yourself, you can start to say, okay, I see you, fear, but without fear, there'd be no courage. And so you have to have fear, because without it, there's no courage. These are different dualities of life. You have to have dark, without it, there's no light, right? You have to have the good to have the bad, right? So we have these different dualities. So looking at fear is like, okay, my brain's trying to predict something bad's gonna happen. But I then can have that thought and then not respond to it in a negative way. I can change the channel. Ketamine is going to give you that cognitive flexibility, usually, to be able to do that. And so I always tell people, like, when's the best time to put out a fire? Right when it first happens. When's the best time to put out a fear or anxiety-provoking thought? Right when it first happens. Right? That's the key, is gaining awareness to your present moment thoughts and then changing the channel when the negative thoughts happen. And so I usually will give people the analogy that if your mental health is a house and it feels like it's on fire, ketamine will likely put the house fire out for you. However, it will not rebuild the house for you. Only you can do that. But without it, the fire is not going to go out. And without it, there's no door to walk through or a window to open, right? It gives you an opportunity. It's like going to the gym and buying that membership. You still got to go lift the weights, eat healthy, get on the treadmill, get the proper sleep. You still got to put that work in. But without the gym, there's no place to go, if we're using this analogy, as a place to reset and heal, essentially, and grow. And so that fear, trying to then dissect it and look at it, rarely is that happening isolated. There's probably anxiety with it, maybe past trauma, depression. So this is like looking at the bigger picture here. But I would approach fear a lot of times as anxiety or worry about the future.
I will say that, and I like, it's not a magic pill. It's not a magic medicine. 100%. You still have to put the work in.
100%.
You're looking at me 2 years into doing this and actively working on my mental health and actively wanting to be in a good place and heal. There is work. There is daily work. It's a daily battle. Like, I wish I could sit here and say I live an anxiety-free life. That's not true. Like,
it's not real.
It's not real. It's not true. I wish I could say I never get depressed. That's not true either. But it has given me the tools and the mental fortitude to not stay stuck in the same place for years and months and even days and weeks. It helps me to break free of it quick. And one of the things I've learned through this process is moving through things quicker makes it easier. Like letting things go, accepting them, it makes it easier. I wasn't able to do that before. So it's really a tool, but you have to be willing to do the work.
I think that's why Marilyn's a fantastic nurse, and we're honored and blessed to have her here, is because she's done that work. And I tell people, turn your mess into your message, right? Then you can actually like speak from an authentic place, and people are like, wow, you've actually done your own work. You battled back. Like, how'd you do it? Right? It's inspirational. And so you know what it's like to go to the therapy, to try the different medications and feel stuck and feel hopeless, and then find something that actually does work. And so this is an active participation program that is not passive whatsoever. There are some, passive approaches to ketamine. That's the Treat 'em and Street 'em clinic. So just be very mindful anywhere you're going to go. How long is the infusion? Is it only 45 minutes? Is it actually 60 minutes? Is there integration? Are you actually seeing a doctor at all? Like, is there dose discussion? Is it just simply like following a recipe, like a cookbook, and giving the medicine, and that's it? Like, it's really important. Do your due diligence. This is a very powerful psychedelic medicine, and everything in life is a tool or a weapon. We're using this as a tool to really help you to get better, but you got to come into it with intention, and you do have to put that work in for sure. Like anything in life, the more you put in, the more you're going to get out.
All right. Okay, this one is it's two different questions, but I'm going to ask them both at the same time because they're kind of the same. First one, I am a recovering addict. Would you still recommend this? And then the other one was, isn't ketamine addicting? So
great question. So number one is like, you're a recovering addict, but what substance was your, I like to call dopamine release of choice? Us as humans, we're all chasing dopamine every day. That's your motivating neurotransmitter, inside your body. And so if it was alcohol or opioids, I would say ketamine generally works quite well for those. But if it's things like methamphetamines, cocaine, generally not that amazing to treat those addictions. Also, like, you have to use ketamine as a bridge. If you're literally ready to be done with it, you have to ask yourself, okay, what was I actually self-medicating myself from? Like, I'm using, they say the opposite of addiction is connection. And so then you're trying to escape from yourself with this addiction or this substance or behavior. And so you can use ketamine as a way to kind of pivot away from the substance, especially if it's alcohol or opioids, but you got to be done using those things. And it's going to help you get into the root cause. Why was I seeking that substance or behavior in the first place? Was it to cope with my traumas and just escape? It all comes down to the intention, of it. And sure, ketamine is a known drug of abuse. 100% not going to deny that. However, in a clinical setting like this with trained professionals, I'm not giving you ketamine to go home with. Eventually, we might do an at-home program once we've established the doctor-patient relationships. but you're just being administered the medicine. Ketamine given in this administrative way in a clinic 2 to 3 times a week for 2 to 3 weeks, that has not been found to have addiction. But sure, can people want to go back to that feeling? You got to look at addiction as like physiologic at a cellular level or psychologic at a mental level. And so ketamine's not generally physiologically addictive. Of course, there can always be exceptions to these statements, but given 6 times over 2 to 3 weeks, that's not physiologically addictive. You're not going to feel withdrawals from it. We're blocking the NMDA receptor. I'm not feeding your receptor. Whereas opioids, feeding the opioid receptor. Now you took it away. Physiologically, the receptor is hungry, and you're going to feel withdrawal effects in your body. Psychologically, ketamine would more so be addictive at that level, that, I just like to kind of check out and disconnect. But here, it's actually really work. It's like a mental marathon in the medicine. So a lot of times you're like, wow, I don't know if I want to go back there again, and generally do another infusion like again and again and again, because that's deep work, that's challenging. So ketamine will be more so psychologically addictive if people are using it for escapism. It's all about the intention behind the substance or behavior. And so everything is done here very intentionally. There is no addiction in our clinic, and I would still treat an addict depending on what substance they were abusing and then how far away from that substance are they. I had a patient recently transition away from kratom, and they use this as a bridge because that works on the opioid receptors. And so ketamine does weekly work on opioid receptors as well. And so it can help mitigate some of that physiologic withdrawal and then ultimately get you to the core, the root of why you were going with that substance, or behavior in the first place.
I will say, I think that's what sets our clinic apart from other ones as well, is that we really are like hands-on with all of our patients.
Yeah, for sure.
Like, we know our patients, we get to know them, we create a safe place for them to open up to where they want to. So this is work, and we're so big on the integration process and understanding the work behind it that it would almost be a disservice to what we believe in to allow somebody to just do this for drug-seeking purposes or for the wrong reasons. Mm-hmm. It would be a disservice to how we approach the whole medicine and how transformative it's been even in my life. So we don't encounter that very often because we are so hands-on here and we are so, connected to our patients here.
Yeah, we often will tell people the most frequent I'm going to really allow you to come back to the medicine is 2 weeks. Generally speaking, about a month is about as frequently as we want to do that. Ketamine does have active metabolites that will stay around in the system for, a few weeks. So then we don't really, it's like, why are you coming back to the medicine so often? Are you doing the work? The integration work. And so we do have an equation on the back of our workbook. It's ketamine plus daily integration practice equals a conscious transformation. It's not just do ketamine and feel different. That's how majority of places do approach it, and it can't help, boost the mood essentially. But I want durability. I want this to help you to last a lifetime. People often ask, how long does ketamine last for? I have 2 answers to that question. Number 1, if you strictly look at the mechanistic action of ketamine, working on a receptor, half-life, active metabolites, usually about 3 to 4 weeks or so, you can have a nice boost in one's mood. However, if you allow it to shift your paradigm, and so that, like Marilynn pointed to, that everything is happening for you, nothing is happening to you, you then go from the victim to the victor, and now you change the lens through which you view reality. And you say, oh wow, this trauma that's happening right now, and I understand these are, it's a big statement there, but how is this happening for me? Instead of why is this happening to me? I'll put my money where my mouth is. When I was 21 years old, my dad drowned. He was 47 years old. 2 weeks later, I almost died from ruptured appendicitis. That all happened for me. It did not happen to me. That is the paradigm and lens to which I choose to view reality. That's going from the victim to the victor and turning your mess into your message. That's a very traumatic thing. I was not ready to hear that the day that happened. Sometimes you're not ready to hear that. You got to meet people where they're at on their healing curve. If they're still stuck in victim mentality, I get it. I'll meet you there. But eventually, we want to rise up and empower ourselves, because otherwise, if I perpetuated my state of suffering, that is on me. Remember, me versus me, right? And so I do really approach it like that. Everything's happening for you, not to you. And ketamine can last a lifetime if you apply the things that you learned through the medicine into your life. And that's what psychedelic literally means, is mind revealing. Psyche, mind, or spirit. Delic from the Greek word delos, to reveal, meaning, or to manifest. I'm getting you to reveal your subconscious mind to your conscious mind, and then you become the medicine. That's the trick of all this. Are you the cause? Are you the cure? That's a big question to ask yourself. Is getting real with ourselves. ketamine makes you look at yourself in that way. So you got to be ready to also engage with this very powerful medicine. Am I ready to shift? Am I ready to do this real work? Because it is real work. It's not escapism. Not here in the clinic. We support you, and I want you to transform and become the best version of you. Imagine this world if every single human being became the best version of themselves. What would this world be like? That's inspirational. And I'm trying to be a manifestation of that. I believe Marilynn is as well as Adriana, right? This is turning your mess into your message.
Yeah. So in short, for me, like, it's very easy. Like, there are lifelong effects of ketamine. I don't struggle with suicidal ideations anymore. That is a lifelong benefit that like, you can't quantify that. You can't put a price on that. That is a lifelong transformation. But like you said, 21 days to 30 days, the medicine is in your body and you feel that like happiness from it or that joy. But what you learn in those days and how your mind changes is just a lifelong, like, it changes your whole life because it changes your whole perspective. And that's really like the thing we're trying to push across is that it allows you to change your perspective, and in turn that changes everything.
And everything in life takes maintenance. Tell me the thing that doesn't. I know, I've asked every person, no one's ever given me the answer. Every single thing in life takes maintenance. Mental health, physical health, all the things.
Yep. Okay, I just want to do a quick shout out to Chell Ray, because she said here she's been clean for 9 years and she did ketamine in her first year of recovery.
Congrats,
so
that's
congratulations.
Catalyst for change.
Yep.
A catalyst is what I like to call it.
Okay, let's see here. Let me see okay, so how many sessions for it to work? I feel like this could be different, right?
It varies widely from person to person. Generally speaking, if you're on antidepressants, we do see a slower response. Usually by that fourth infusion or so, we're starting to see people kind of turn the corner a little bit. I've also had people that are on no medications, and even that first infusion sometimes is just like very enlightening and awe-inspiring, and they feel like the depression or the suicidality can start to lift. But we do 6 infusions, as we call induction or stabilization, over 2 to 3 weeks, and then we're going to assess your progress and then recommend either a fork in the road. It's either maintenance or optimization after the initial 6 infusions, which is known as induction or stabilization. This is some of the nomenclature around it, so you kind of know how to kind of talk through it. If someone's, say, we're very evidence-based here. So say someone's PHQ-9, it's at a 27. Say they're like a 20 is where they start, and they're down to like a 5 or something after the 6 infusions. I would then say you made quite a bit of progress. Let's now go to maintenance. Maintenance, generally speaking, will be 1 infusion a month for a couple months and then reassessing. Doesn't have to be, that's generally speaking recommendation. Now, if someone had a 20 out of 27 PHQ-9 and then went down to maybe a 15, I'd say, look, we're making progress. However, optimization might be your best, fork in the road right now, which is doing 1 infusion a week for 2 weeks and reassessing. The studies do show that doing induction out to 8 and 10 infusions can also help work for people. We don't want it to stop after 6 if you're making progress, especially if you're on antidepressants, because there's a delayed response sometimes to the medicine. So it's all individualized. It's hard to just pin it down, black and white like that, but we're very evidence-based in our practice. We were that way with Adriana. I know we might get into the showing her scores and that kind of stuff, and how now she's more in a maintenance program versus optimization. But it's individualized care, overall.
Yeah. So this question kind of relates to that. Should I stop taking my antidepressants before I start ketamine therapy? If so, how much?
Yeah.
How much
So
time?
I'm not your doctor, right? So we're not going to take this as medical advice. Generally speaking, I only want to change one variable at a time. And so if you're on antidepressants and you've been on them for a number of years, let's just say, for instance, it's Prozac or something, right? Prozac is a very long half-life. It's about 5 to 7 days. It takes 5 half-lives to clear 98% of a drug. So then you would take 5 times 7, and we're at 35 days basically to clear that drug physiologically from your body. Do not stop your antidepressants cold turkey ever, okay? You're gonna have really bad withdrawal effects. So you need to taper slowly with your psychiatrist or family doctor or whoever is prescribing you this medicine. If you're on antidepressants, you've been on for a number of years, if you're not on ones that are going to block the effects of ketamine, those are only going to be things like lamictal or lamotrigine or benzodiazepines. Then we want to kind of get the dose down a little bit before you do start, generally speaking. If you're on SSRIs, SNRIs, things like that, we will keep you on those things, and then we will start the ketamine, because that's the one variable we're changing. If you change more than one variable, you don't know what's helping or hindering. And then after we kind of stabilize you and get you to a good place mental health wise, now we can look at tapering off one medication at a time. It must be a very slow, methodic process in order to not have really bad withdrawals though. So definitely always work with your medical professional. I'm not your doctor, so don't take anything I'm saying as medical advice. This is generally speaking.
So for me, I was able to go off of all of my antidepressants, and I only do ketamine. I do a booster about every 3 months, and that's all I've needed. So that's just my personal journey.
My goal for most patients is to eventually get you off most medications. There's always a time and place for medications. I don't want to demonize them. But a lot of times I do feel like they have a lot of side effects to them. They numb you, feel like a zombie, libido changes, weight gain, just like brain zaps when you try to come off of them. So there's a lot of side effects. And oftentimes what happens is people might be on, I don't want to demonize Prozac, so I'll use a different one, say Zoloft. Say you're on that for 20 years, and then you try to come off of it pretty quickly, or even just do a taper. You're going to start to feel worse because you're withdrawing. People oftentimes think withdrawals, benzodiazepines, alcohol, opioids. Oh no, it's SSRIs and antidepressants as well. And so what's happening is you're feeling withdrawals until you get through that physiologic window. So you're going to say, oh no, the antidepressant was working, I'm feeling worse. No, you're having withdrawals. When you eventually get through the physiologic window, then you will likely feel better. Ketamine can help mitigate some of the physiologic withdrawal as you come off some of these antidepressants. So we got to work with you in your individual situation. But generally speaking, I try to get people to get off a lot of their medicines when appropriate, and then also eventually work away from ketamine. I don't want this to be a lifelong medication for you. I think it's very important, if you're ever going to be put on a medication from a physician, ask them, what is their long-term game plan here? Is this, an antidepressant for a few months to get me through a depressive episode? Is this lifelong? That's an important discussion to have. A lot of these medications were never intended for lifelong usage. However, that's what we're seeing. And so it's just really important, like anytime you're putting a substance into your body, asking yourself, what is the cost of this? A lot of times say you take a benzodiazepine, I call it like basically taking a loan on your anxiety. It's going to eventually come back due with interest. So just realize that, not to demonize, but just to be very intentional with whatever we're allowing into our body medication-wise.
Yeah, I can only speak to my experience with medication and SSRIs, and I have been on them. I don't ever demonize them, because I will say they did enough of a job to make me be able to get up and go to work every day and provide for my child and maintain some kind of life. So I will credit that they did something. However, I never fully had to address my pain because I never really felt it. I didn't have high highs. I did have some lows. For me, it kept me more from going high, having too high of highs, so that the lows didn't feel so low. But looking back, I felt like I lived at a low every day. It was like a numbness, a methodical, no hope, no excitement. It was just this kind of low. And as long as I wasn't so low that I wanted to die, I could function. And then I never really had to address that pain. When I took that away, it kind of forced me to address the pain, but I was so overwhelmed by it. Like many people on antidepressants, you try and go off, and then you get worse, and you're like, oh my gosh, I better stay on it because I didn't realize I was still this messed up, right? And so I was kind of stuck in that cycle. Go off, feel worse, suicidal ideations are worse, pain is too overwhelming. With ketamine, I was able to go off and deal with the pain, but not be overwhelmed with it. So that's how it helped me.
Yeah, a couple of things I want to touch on because you kind of brought up in my mind is that imagine your mood is like a 1 to a 10, right? 10 out of 10, I'm super happy, blissful. 1 out of 10, I'm in the dumps, I'm super depressed. A lot of times what an SSRI and antidepressants will do is they're going to raise the floor, but they're going to cap the top. So now you're living at like a 3 to a 6 type of life. You're not going to have the 1s and 2s, but you're also not going to have the 8s, 9s, and 10s as well. And so if you're okay living that 3 to 6 life, that's kind of what it does for you.
I would say like 3 to 4.
3 to 4.
For life, like that kind of was where it makes you kind of feel. It's kind of this this is what life is, and there's not much more to it.
Totally. Like I've heard people like say they're just so numb, like their animal or pet dies, and they're like, I didn't even cry. I didn't even grieve properly. So I wasn't feeling my feelings. It kind of takes away that ability. The other thing to look at too is we do something called pharmacogenetic testing, where you can just do a swab of your cheek and then I can get basically your liver enzyme profile. I can check for things like methyl-tetrahydrofolate reductase deficiency, the MTHFR, aka the motherfucker gene. And if you have that, then you would be good to supplement like something like L-methylfolate, which actually help your SSRI or SNRI to work better. And so we want to like look at you as that whole person. Is there hormonal deficiencies? Is there different enzymatic problems in your body? Different things we can look at with pharmacogenetic testing, blood work, right? Look at the whole picture, not just throw medicines at you like it's a medication merry-go-round. That's important, and that's a test you do once in your lifetime. Pharmacogenetic testing, cheek swab, very easy, and you'd have that information for the rest of your life. It's going to show you medications that fall into basically a green, yellow, or red category, show your liver enzyme profiles. Blood work you got to do all the time. It always changes. This is once in your entire life. It's not crazily expensive as well. It's generally around $500. So that's something, if you've been on antidepressants and you're kind of jumping around pill to pill, maybe something to look at as well.
And I always say this, I was on antidepressants for 5 years before a doctor ever told me that I should get therapy with it.
Oh,
ever.
huge, yeah.
5 years. So basically I was treating the problem but not the cause.
Totally.
And so that's my other like kind of problem with it. Like there's nothing wrong with SSRIs. Like I said, they helped me for a time and significantly, but they never like it has to go back to that work and that integration. Like
Totally.
it's easy to just throw a pill at it and not say, oh hey, you need to actually get to the root cause of why you feel the way you feel or why you're having these emotions.
You got to get to the root. Yeah, and if you go through our program, you have to do integration coaching. Is not optional. You don't just do the medicine. That's not what we believe in here. This is a program. I'm trying to get you to heal, and you can't see your own blind spots. And the integration coach can help you to see that and then implement the change in your life and then get durability out of this treatment. So you might spend more money up front with our program, but you're likely to save money long term because you're coming back to the medicine less frequently. My goal for every patient is eventually get you to work away from the ketamine to realize that you're the medicine in your daily practice really matters. Your nutrition, your sleep, exercise, meditation practice, sense of community and purpose, spiritual practice. I mean, the list goes on and on. Those are the real medicines there.
And I texted Dr. Leathem, I recently had surgery and I texted him afterwards, like I had been able to walk 3 miles after a few days after surgery. And I texted him and I was like, look, I'm the medicine, because he says that all the time. But I really believed it. Like, and I do believe it to this day. Like, I am the medicine. Like, I can genuinely heal my body and heal my mind and heal my emotions. And that is not something I could do before ketamine. Like,
and exercise is a part of your life.
Exercise is a daily part of my life now, and it was just like a kind of a full circle moment. Like I was truly like actually.
Mm-hmm.
Yep. Okay, this question is for Dr. Leathem. Have you ever struggled with depression or mental health issues?
I have, actually. Like, I'll be real with you. I'm pretty authentic. You're only as sick as your secrets. So my freshman year, first year, my internship of residency, I was suicidal because I literally was working over 100 hours a week, and I would go to work in the dark. I'd come home in the dark. I was at Michigan State. It was February. I had done medical school in Arizona. Lots of sunshine, fantastic. And I was like, what am I doing to myself? Am I masochistic? I caused this. I signed up for it. I have $280,000 in med school loans. I'm working 100 hours a week, and I hate my life. And because you're an intern, you're not getting to do anesthesia. That's what I wanted to do at that point. And I was like, I have a gun in my closet. Maybe I should just end it right now. Then all the suffering would stop. However, that's not my story, and it's not your story to give up on yourself. The comeback is greater than the setback. And so I powered through. Tough times don't last, tough people do. And so I'm basically a living example of not giving up on oneself. And ironically enough, when I was having these thoughts, this was 2012, February in Michigan, living in Lansing. And like I'm saying, February, going to work in the dark, coming home in the dark. And there was a sign on the wall in the hospital, and it said, if you're not happy, change your situation. Well, I couldn't change my situation. I was in a ton of debt, and I had signed up for this. So there's no way I was going to pay back almost $300,000 in loans unless I finished. So it said, if you're not happy, change your situation. Couldn't change my situation. So what did it say next? Change your mindset. And so that's what I did. I said, this is not forever. I will power through this, and I am now a living manifestation of that. I've been a physician, finished med school 2011, residency 2015, So really a practicing physician for over 10 years now. And that's part of my story, don't give up on yourself. And it's your darkest times, if you can battle back from them, that allows you to gain the wisdom and the power and perspective. Look back on your own life. Anyone that's watching this right now, I commend you for making it this far. Thank you. Don't give up on yourself. The comeback is greater than the setback. And is there a time in your life that you literally grew or gained wisdom that was not on the other side of a traumatic or challenging time? I know of none in my life. Like I said, no rain, no rainbow, right? No pain, no gain, no mud, no lotus. I don't make the rules, I'm just an interpreter. And so that is a direct example of me battling suicidality and depression, and I did not give up on myself, because that was not my story. I was not the kid that gave up on himself, made it all the way to med school, got the anesthesia residency, and ended it. No way. And that's not your story either. And so this is the story of the hero's journey. You are the hero of your own story. And so please, you got to tread that water sometimes. It's not forever. That was like a 4-year jail sentence being in Michigan. But now I get to live and tell the tale and help people to navigate their challenging times. So it all happened for me, did not happen to me.
Thank you for sharing that. Okay, this one, this person kind of asked 2 questions. What made you get into this line of work, and what is your history with psychedelics in the past, not in a healthcare setting?
Yeah, so what made me get into this work? Well, really, number one was the COVID pivot. And so literally we're anesthesiologists, work in the hospital, working in surgery centers, and the elective surgery stopped during COVID. So I literally had no work. And I was like, well, I know there's a mental health epidemic. I'm very knowledgeable about psychedelics. I think I could do it better than how it's currently being done. And we've shown that to become true. And so over time, we slowly left anesthesia practice. Me and my 2 partners. It was a 2-year slow pivot away from the hospital-based anesthesia, surgery-based anesthesia. And I'm a psychonaut. I try to tell people that be the successful psychonaut that society tells you does not exist. There's actually a lot of them out there. Joe Rogan, Elon Musk, Sergey Brin, list goes on and on. So these are catalysts for transformation. Can they also be abused? Of course they are. So everything in life is a tool or a weapon. That's money, that's love, that's psychedelics, that's everything, right? So you got to ask yourself and be real with yourself. Am I using this to connect with myself and further evolve my perspective and grow as a human being? Or am I using this to escape? Right? Not to demonize recreational use, psychedelic, because I've done that as well. I've lived life and explored my mind, but I've also used it in a medicinal setting. It's always been to connect and to evolve my perspective and grow as a human. And I haven't felt the need to actually go back to psychedelics that often, because I've done a lot of the work in the prior years. I did ayahuasca ceremony back in 2016. I was living a double life. I was working as a hospital-based anesthesiologist, but I felt this calling to go do ayahuasca. And I did it, and it was transformational in my life. But with me, a lot of things I do one time, and I can just let it go. I got the message I was looking for. If you want to hear more about it, there's a great podcast called Psychedelic Journeys. Check it out on Spotify. You can find me on there. Just type in my name. I tell more about this experience in depth. Other psychedelics, ketamine, LSD, psilocybin, the MDMA. If you use these things as ways to get and better in touch with yourself, they are tools and not weapons. And so, honestly, I often ask patients, ask yourself this: would you go to a virgin sex therapist? I have never heard anyone say yes to that question. Therefore, I'm a psychonaut helping to lead you down the path of psychedelics. You want to go with someone that's like your ketamine Sherpa, that's going to help you to navigate the bumps in the road. And I will help you to do that because I've gone there and I can help you to navigate a very challenging experience. There's no bad trips in my clinic. There's a challenging or a less challenging experience. And the challenging experiences, if you integrate it, literally, usually becomes your greatest healing moments, So it's all about that perspective and being with people that are very experienced in the medicine as well. So yes, I have explored my mind with psychedelics, but that's outside of work, never at work. Why would I want to do such a thing? I'm stone cold sober when I come in here, always. Maybe a little bit of caffeine, that's about it. But I do explore my mind in my own private time to further evolve myself as a human being. This is a human operating system. How do you upgrade the software? Psychedelics is one of the ways.
I want to answer this because I think it will help some people. Before I came and worked here, I had no experience with psychedelics, none whatsoever. Not recreationally, not therapeutically, none. I was in a really bad place, and they did not know that, obviously. I had a friend who said that she got ketamine. She went to work at a ketamine clinic and she got a discount on it. and it was helping her. So I was looking for a part-time job. I found this was the first place I applied for. I think it was meant to be genuinely meant to be. Yeah. And really it was because I wanted treatment. I was desperate for some kind of help. And I had, like I said, I had never done I had a patient once who gave me shrooms and I threw them away because I was like, this person's crazy. Like that's really where I was coming from. I had no idea. Since working here, I strongly believe there's a difference between doing psychedelics therapeutically and doing them recreationally. And had I done them recreationally prior to working here, I would have a different experience and feeling about them than I did from working here, because they were able to guide me through it and tell me what I was feeling and processing it. And I had already done the ketamine, so it made me feel, I guess, like have a better understanding of the therapeutic benefits of psychedelics. So it's just a different way of seeing it. I believe if I had done psychedelics prior to working here and understanding ketamine and how it works and how it affects you, I would have a negative view of them. That's genuinely what I believe.
Yeah, and also like any clinic you're going to go to, ask the people giving you the medicine, have you personally tried this medicine? You're going to be surprised to find out the vast majority have not. So you got a lot of virgin sex therapists out there, unfortunately. So ask them. I think it's important. I'll be full disclosure. I'm out of the medicine cabinet. I met Rick Doblin, the guy that founded MAPS, and I said, listen, like I feel like liberated because you've made psychedelics more acceptable, and I'm out of the closet. He goes, no, you're out of the medicine cabinet, and it feels liberating that I can be my authentic self and share these stories. I've literally been doing psychedelics for 30 years. The first time I ever connected with cannabis was when I was 13 years old. Of course, it was not in a medicinal way. It was more to try it. You're 13 years old, your friends are doing it, and that's my first connection with a psychedelic. Ketamine is a stronger psychedelic. Cannabis is definitely a very mild psychedelic, depending on the route of administration. And so knowing that, hey, look, this guy did psychedelics. He still became a physician, an anesthesiologist. He's not glitchy. You can't tell he's doing all these psychedelics. Yes, be the psychonaut society tells you does not exist. You can still do these things. I do not drink alcohol. I actually have an allergy to it. I think alcohol is one of the most dangerous substances on the planet. As opioids, benzodiazepines, SSRIs are all legal. So it's like, don't allow legality to skew your judgment of all these things like good or not, right? Like that's a bias, and you can die from only 2 drugs, the withdrawals on planet Earth, okay? Alcohol and benzodiazepines. Barbiturates as well, but barely ever used nowadays. Opioids, you'll feel like you're gonna die from withdrawals. You will not, generally speaking, but you can have withdrawal seizures from alcohol and benzos. So just kind of look at these things, do it in a safe environment, don't do it where it's illegal. Other states, like Colorado, Oregon, a lot of things are decriminalized. Ketamine is the only federally legal psychedelic right now. And even if every psychedelic was legal, ketamine still has a place at the table because of how we can titrate it to the desired affection. I call this the most controllable psychedelic medicine on planet Earth, because I can literally just press the stop button when it's given via IV infusion and pull you out of a deep experience in less than 10 minutes. So just go to a ketamine clinic, see how they administer it. If it's intramuscular, nasal, sublingual, there is no stop button, there is no antidote except for time, whereas here I can literally shift gears for you very quickly. So for you to get a human being to really relax, you have to feel like there's an element of control, and you are in control when you do an IV infusion on a pump, not with just a drip going in, because ketamine is a diuretic. You want to have it in infusion pump, so even if you change the position of your arm, you're not going to affect the infusion quality. So just really go and visit the clinic, see if the space feels right, the energy feels right. We talk to everyone for free in person. That's fine. I will do that because you're making a big decision and investing in yourself and your mental health. And any place that's doing it, that's above board, should be doing it that way, in my opinion.
Yeah, I feel like once people have come here, nobody leaves saying like, oh, I didn't feel safe. Like you will feel safe here.
Great
and
point.
You will feel confident in the journey that you're about to take here. Like you do feel safe.
The first step in any transformation to heal is safety. You must feel safe. And then you have to be safe and then ready, willing, and able to make a change in your life. And so that's paramount. There's cameras in every single room in our clinic. If you go to a clinic and do ketamine or any psychedelic and there's no cameras, leave the clinic, okay? There's no objective eye in there. And it's then he said, she said, or whoever said, everything's recorded here. There's no audio in there, it's just video. So you have a complete objective eye, so you feel safe. You can pull the tape if you want to. That's important. There must be cameras whenever you're doing a psychedelic experience, and you should have trained professionals with you to make it a very therapeutic, healing experience.
Yes, okay. Someone said, my husband almost died and spent 32 days, 25 on a ventilator because the hospital stopped his benzodiazepam without telling us.
Mm-hmm.
Oh, wow.
Yeah, only 2 drugs you die on planet Earth: alcohol, benzodiazepines.
Scary.
They're legal.
Both are legal.
Both are legal.
Yeah.
So just realize, guys,
Yeah.
realize, legal doesn't mean it's okay.
Yeah.
Some of the safest substances on planet Earth are illegal. One of them being psilocybin. I hope one day that will be, decriminalized and legal in a medical setting. It's nearly impossible to overdose on them. It's like something like 30-something pounds of psilocybin mushrooms you'd have to eat. If you ate 30 pounds of bread or eating 30 gallons of water or 30 pounds of steak, you're going to die. So it's a very safe substance. Legality does not mean safety, right? That's a key thing to experience and know here. So never stop any medication abruptly.
Okay, you kind of touched on this a little bit, but this was a question from someone. I'm nervous. If someone's having a bad experience, are you able to stop it in the middle of the session?
Yeah, for sure. That's what I'm saying. If it's an IV infusion on a syringe pump, I can literally press stop. And so here's the thing. Proper preparation prevents poor performance. A failure to plan is a plan to fail. Therefore, before you ever do an infusion with us, you've met us in person and done a 30 to 1 hour free in-person consultation. You've done a 1 hour prep session with your coach over Zoom or over the phone, whatever your preference is, and you also have access now to your workbook. You're coming in prepared, so it's exceedingly rare that you would have to stop it, especially on a first infusion. I'm also walking you into the medicine for the first 10 minutes of the infusion, right there with you, going through breath work, body scan, being the curious observer, getting the mind right, how to navigate the experience. So IV infusion, I could just stop it, bring you out, recalibrate. Do you want to go back in, or do you want to stop for today? So very controllable, only when it's done on IV infusion. Ketamine is the most controllable psychedelic medicine experience on planet Earth, and I coined that phrase.
Listen, well, I'm not going to sit here and say that people don't have difficult infusions.
Of course
they
can,
have
yeah.
difficult infusions. Difficult things come up. There are times where people feel scared. They feel alone. They feel, I personally have had moments in ketamine therapy where I feel so alone, and the aloneness is so overwhelming to me. But that's where my trauma lives, like that. And I have had to learn to navigate through that and walk myself through it. And it's so incredibly healing to be able to say, I'm alone and I'm okay. This aloneness is not going to kill me. But those are the challenging things in my infusions. Some of them never happens. Some of it's just great. Like some of them I see myself, jumping on planets through mushrooms, and it's amazing. It's like truly like a great time. Some of them are more difficult. And plenty of patients have had difficult infusions. The ones that don't come back after a difficult infusion, in my opinion, are ones that are just not ready to do the work. They're just not ready to do the work. So if you have to make sure you're really ready, and part of that is feeling safe and being ready to encounter yourself. It's not going to show you anything that's not already in there. It's just not. And I have a fear of aloneness. I have a fear of rejection. And it does take me to those places, but it also gives me the strength to get through them. Mm-hmm. And so if you are ready to face it, it will. It can be life-changing, it can be powerful, it can be difficult in the best way, but you have to be ready.
Yeah, progress requires discomfort. Diamonds are made under pressure, right? And so you do definitely have to be ready for this. And people often like, what's it like, right? So I'll give you kind of some of the hallmarks here, is that you might feel like you're floating in outer space. It might feel like you've entered a dreamlike experience. You might have visuals, you might have none at all. Things might seem realer than real. You might think you broke your brain and you're never coming back. 100% guarantee you're going to come back.
You might not know where you're at.
Yeah, you might be very disoriented. The key is to be the curious observer, right? Stay curious. It's nearly impossible as a human being to be anxious and curious at the same time. Almost impossible to be afraid and curious at the same time. So you want to trust, allow, receive, surrender to the medicine experience. Know that I'm going to make sure your physiologic body is safe and you'll get through it, and then know that you will emerge a better version of yourself. Can you have a challenging experience? For sure you can. Can you feel like woozy and a little disoriented after? Of course. Generally speaking, the next day you're completely back to normal. People are going back to work, and there's other medicines we can add into the infusion to help accelerate the recovery process, such as NAD+, nicotinamide, adenine dinucleotide, energy at the low of the mitochondria. So these are other things we do add into the medicine. We do not just do straight ketamine. We have a proprietary blend of medicines. And so ask people that are going to be giving the medicine. You do just ketamine, you add other things in there. Most common side effects, nausea, headache, fatigue, constipation. I can treat all those very easily as long as you tell me what's happening.
Well, and also we give everybody a call light. So like
totally.
We give everybody a call light so you can control it. If you are experiencing something in an infusion that you don't want to go there, you're not ready to go there, you can control it. You can press a button, we can stop it. It'll pull you out within a few minutes. Unlike other psychedelics, like once you're in, you're in.
Okay.
So you can, to a level, you can control this. It may make you face things that you didn't want to face, but you can quickly put the brakes on that if you're not ready to go there. You know, you get to a point in it that you're like, okay, I want it. I want to face those things and I want to work through them. Like I said, I had to get to a point where I was able to sit with those feelings of aloneness and tell myself, this isn't going to kill you. Nobody ever died from being alone. And that was when I really saw a lot of breakthrough in the infusions for myself. But before that, I could control it and I could just say, okay, I don't want to be alone. I'm going to shift this to a different place. So it's really not something to be scared of.
We often say the medicine gives you exactly what you need, but maybe not what you want, right? But always trusting life is giving you exactly what you need, but maybe not what you want. It's not happening on your timetable. It's happening on divine time. You know, so try to trust that process. That's one of the things on our wrist here. Trust the process. Will help you evolve your perspective. Ketamine is that catalyst for that.
All right.
This is fun. More questions? Let's keep
I do have 2 more on here. So how would you track progress?
Yeah, beautiful. So we use a electronic medical record called Osmind, and then we give you different survey scores before you ever take any infusions with us. That's your baseline. So like I said, you get the GAD-7, general anxiety disorder, is 7 questions, 3 points each, out of 21. PCL-5, that's for PTSD, that's out of 80, and so that's a significant number of questions. And then the last one is the PHQ-9, 9 questions, 3 points each, that's out of 27. And then we do an ACEs score, adverse childhood experiences, out of 10, and then an SSRS to check for suicidality. People often will treat chronic pain with ketamine as well, and so we do a pain score, people have that, maybe an ADHD score as well. But generally it's the 3, the GAD, the PHQ-9, the PCL-5, seeing your baseline score, seeing the change after infusion 3, and then the change at infusion 6, and then seeing that change in baseline will deem basically maintenance, optimization, was it a success, was it not a success? And you know, I'm going to share Adriana's scores with her, and she might also like kind of put that on the screen as well, so you can see the change from her baseline, and everything is essentially in remission at this point. Everything does take maintenance, but it's been a few weeks now, and she's seen some good durability from this as well. It gets you unstuck, you know, It gives you that quick win to say, oh, I can feel better. I almost look at like, in a way, like, you know, GLP-1s, they're very popular for weight loss. I think they're a great little boost for like 3 to 6 months to give you that quick win. All of a sudden, like, hey, I'm curbing my appetite, I'm going to the gym, I'm seeing these changes. Ketamine in a way is almost like a GLP-1 for the mind. It gives you that quick win, and you're like, wow, I feel better. I'm going to start to change my behaviors. And then eventually you can work away from the GLP-1, work away from the ketamine, and realize that it's your daily practice. That's really the medicine here.
I mean, mental health is very hard to quantify. Like,
very hard, yeah.
It's
Emotions,
very hard to quantify. So we use these scales and these surveys to kind of give us a little bit of an idea, so a visualization of where I'm at and where I'm trying to get to. But it's really more about, that's just one part of it. It's how you feel and what you're doing. I personally still continue to do the surveys and the questions. I do them once a month because for me, it's a good check-in. Like, okay, where am I? Am I feeling more anxious? And now I like know the questions, and I'm very, very honest with myself. And I'm like, okay, yeah, I am more anxious this month. Maybe it is time for me to come in for a boost and do ketamine. Maybe I need that reset right now. So it's quantifying, but those surveys teach you to look at yourself, because life gets busy, life gets hectic, different stressors, to stop and say, okay, am I prioritizing my mental health? Where am I? Am I doing my daily practices? Am I, doing all the things I've learned, or have that just all gone out the window and I'm kind of chaotic again? So.
Do you want me to show you the surveys on the computer?
Yeah.
Just gonna grab it.
Sure.
Here, we'll do it live, guys. So this is, Adriana being, transparent and open
And
with
I
us
feel like
as
all
well.
you guys here on live probably know, because I've talked about it so much about, around March, I was feeling very suicidal again. That was my husband's death anniversary. So coming in here, I was pretty bad.
Is this a good view? Can you see it on the screen?
Here, let me get a little closer.
I can come to. So this is PHQ 9 here, right? I said 9 questions, 27 points. Where Adriana started, score is 20 out of 27 on May 4th. That was our first data point before she started with us. The black lines are the infusions. And then here's her second score after infusion 3, down to a 13 from a 20. It's also a pretty quick drop, really quick. And then right before her 6th infusion was an 8 out of 27. So we have a drop from a 20 to an 8, over a 50% drop in her depressive symptoms. If we survey this again, I'm expecting it's probably trending downward as well. If we're going to look at her PCL-5 score, obviously lots of trauma. You guys know a lot of her history here. She's dealt with grief extensively. 59 out of 80 on that PTSD score. Anything over 32 is considered clinically significant. After that 3rd infusion, down to a 31. And then at a 20 as of May 19th, we'll survey this again and kind of see where she's at. And then also looking at an anxiety score, 17 out of 21 before she started, down to a 12, and then down to a 7. So another 50% or greater reduction from baseline scores. Like Marilynn said, we're trying to quantify a qualitative emotional state. It's very challenging. These are not perfect surveys. They're from psychology and psychiatry. A lot of times people say, oh, like the question's like not at all. And then like the next lowest choice is like several days. And people are like, what about like 1 or 2 days?
In between.
And so, so I wish there was that. And so a lot of times they say just round up and say several days versus not at all. So it's just the best way. And people forget where they came from.
Yeah.
Like you forget, like where was I a month ago? You got to celebrate these little wins, and it shows you that like, oh my gosh, I was like house is on fire. Now I'm doing pretty good. Okay, like
I will say that. Like what I love about this, it's kind of like, okay, that doesn't show the whole picture. But what I do love about this is that even 2 years later,
Right,
2 years later, I am not where I was 2 years ago. Like it's never gone that far up. No, and I've been through traumatic things in the last 2 years. Mm-hmm. It's never that high, and that goes back to the how long does ketamine last?
Yeah, that's
a lifelong change.
Mm-hmm. Yeah, I totally. Yeah, you forget where you came from. You're like, really, it's the present moment. You're like, oh, I feel good right now. Then I'm good. So depression is dwelling on the past. Anxiety is worrying about the future. The only part of life that's actually alive is right now, is the present. Yesterday's dead, tomorrow's not born yet. And so if you want to feel more alive, be more present. Ketamine, psychedelics, done with intention, with proper support and integration, gets you more present. And maybe the present is just that, it's a gift. And maybe that's partly why we call it that. And so where are you right now? If you don't feel optimal, could ketamine maybe be right for you? Explore that. And call a place like us, look at your local, just go on Google, type in ketamine clinics near me and kind of start to look at the reviews. That's important. Call the clinic. They should let you visit. Demystify this. I know it can be scary because it's a psychedelic. People heard about Matt Perry and that kind of stuff. It's a very different situation. So very, very safe medicine when done with trained professionals in a setting like this.
Okay, so I just have one more question here that I wrote down from my question box. So if anyone watching has a question they want to ask, go ahead and type it out. So this one is, I guess it's kind of a 2-part. How do you explain this type of therapy to people who don't believe in it, and what's the biggest takeaway from doing it?
I can answer that. I come from a very conservative, evangelical Christian background. I personally still consider myself a Christian and believe in God. If anybody from my background walked into this clinic, they would feel, I'm just being honest, they would feel like I was doing something that goes against my religious beliefs or how I was raised. I truly believe that God used this to help me heal and be free and live in my purpose. And I believe that he put me here so that I can relate to people who have been in my circumstances and been through religious trauma. We have a lot of people who come through here who have been through religious trauma. I had a ton of religious trauma. And I personally believe that this helped strengthen my beliefs and my relationship with God outside of organized religion. It really helped strengthen that for me. So that's my personal experience. And I really had to come to a place to understand that if people think it's wrong, it's because they don't understand it. and they don't have to understand it and they don't have to agree with it. But I can tell you with all certainty, it does not go against my convictions as a Christian. So
I would say, like, to not believe in it would be like, well, let's start to, like, I guess, demystify your beliefs. You know, like, are you just kind of like picking and choosing? Ketamine's a molecule, okay? Carbon-based molecule. So if you say, I don't believe in that carbon-based molecule to help me feel better, but I then believe in Prozac, another carbon-based molecule to make me feel better, there's a little bit of a misalignment there. And so I want to discuss with the person, is it psychedelics you don't believe in? Because ketamine's an atypical psychedelic. You know, the classic psychedelics are psilocybin, mescaline, LSD, DMT. You know, so then you want to say, like, what don't you believe in? And I think a lot of times it's just...
I don't think it's that they don't believe in it. It's that they believe it's wrong.
Oh, believe it's wrong. But then are SSRIs okay? Still molecules. Right? So it's the category now that ketamine is actually a dissociative anesthetic with psychedelic properties. I'm going to tell you, life is psychedelic. Becoming a parent is psychedelic. Breath work can be psychedelic. Art can be psychedelic. So it depends how loosely you want to use the term. It just means mind revealing. And so if you're saying that ketamine's against your religious beliefs, well, I'll tell you, on the recent episode of The Secret Lives of Mormon Wives, season 2, episode 1, they say it falls in a gray area. Go and watch that episode 45 minutes in if you want to fast forward through. And they literally say ketamine falls into a gray area in the Mormon church. You know, it's not strictly demonized, but it's not, you know, said, hey, go do it. So I think it's important to just kind of look at one's thoughts and beliefs and paradigm that they're in and saying, like, maybe I'm just kind of a little bit misinformed. It's just a molecule. It's a carbon-based molecule that we're using to help you feel better. And so if you start to break it down like that, maybe you'll start to question your own beliefs and say, hey, maybe this can help me. It's on planet Earth. You know, it is made here. So it's not as if it's from some alien environment. So I think it's important just to kind of look at one's beliefs, one's paradigms, and say, hey, maybe I should evolve the way I look at this. You know, maybe it was demonized, you know, by society and the media, and maybe it's actually a very safe thing to access. And like I said, just a molecule compared to other medications.
And
so
I have found that people have very deep spiritual experiences.
You can definitely.
It definitely reshapes, like, your relationship with God. It can definitely have a lot of people come out and say, I realized that God loved me and he didn't hate me. So it can have very spiritual side. For me personally, when I know that some of my patients come from a very religious background, I like to kind of cater it to them. So I'll do instrumental worship music during their infusions rather than the typical music. So it can be very catered to you. And if that's something that's important to you, like if you don't believe in crystals, we have squishy brains or other things. Yeah. So we're not just disregarding people's belief system and their convictions because those things are very deep rooted. We are trying to make you realize that God created you. Like for me, I realized that God created me in a certain way and he didn't want me to live in that pain, and this was a tool that he used to let me get closer to him because everything is to draw me closer to him. So that's what I believe, and that was my personal experience. So
yeah, the medicine can be profoundly spiritual. Oftentimes people say I felt connection to a higher power, interconnectedness of all things. You know, people have an ego death experience sometimes, you know, when you get into the deeper doses of the medicine. And so it can be profoundly spiritual because, I mean, literally we are all one. We're on this blue dot that's literally going around the sun at over 60,000 miles an hour, spinning at over 1,000 miles per hour. You know, we're infinitesimally small when you look at the scale of the universe. And so our separation is an illusion. We're literally all one because we're all on planet Earth, and Earth is our mother, it's our host. We're basically like a bacteria on planet Earth right now, and without Earth, we're not alive. And so then you're also an Earth, and you're a universe. You have trillions of cells inside your body, and then you have a microbiome and all these things as well. So it's as above, so below, as within, so without, and just starting to zoom out. If your problems seem big, start zooming out, see the bigger picture. A lot of times we're sweating the small stuff. We have to kind of get out of the way of our self-limiting beliefs and just start. This medicine allows you to do that. So it can be profoundly spiritual, but I will cater to people's belief systems and not challenge you in any way and try to really come at this very unbiased. We have all the rooms that have different themes. We have 6 rooms here. One of them is the maze room. It's just an Arizona-themed room. There's not a lot of psychedelic art in that room. If you want to be lack of psychedelic emphasis, we can just go there, right? We try to cater to all 5 senses when you do the medicine. Essential oil for smell, picking all the music for you. If you want to bring your own music, you're welcome to do that as well. We do vibroacoustic therapy. We do vibrational touch therapy with the Apollo Neuro. taste at the end with electrolyte popsicle, sight, plenty of psychedelic art, as well as green light therapy. Every single sense has been catered to. I'm trying to give you a very unique experience here. And then the more senses you touch, you're creating this neural web essentially. The more senses I engage in an experience, the more likely it's going to leave an imprint and you're going to remember it and get durability out of the experience essentially. So this is ketamine done at a very high level. And I encourage you to just look around you if you're feeling like this intuitive pull to explore this medicine and you feel like you're treatment resistant and you've tried things that aren't working. This might be an answer for you, or one of them. I tell people ketamine is the key to me, but it's just one of the keys. There's many keys out there, nutrition, sleep, and exercise, and sense of community and purpose, and finding your why, and all these things, spiritual practice, the list goes on and on. And so definitely, I'm not ever trying to challenge someone's beliefs. We're just here to support you. We also do integration coaching with a company called Being True to You, and they also do approach this from a very non-biased place. I want to be sensitive to people's belief systems, and I'm just trying to give you an opportunity to heal and realize you are the medicine.
I've never been told once, I shouldn't have my belief system, I shouldn't be Christian. So if you do come from a religious background, any religion, you will feel comfortable here. You're not going to feel like, I shouldn't be doing this is a secret, or anything like that. You really won't. So.
Yeah, this is a no judgment zone, not just Planet Fitness, but also here, no judgment zone. And I'm just here to help you become the best version of yourself, and ketamine can be a catalyst for that, for sure. So thank you for listening all this time. Any last questions?
Yeah, questions. Yeah, thank you guys for hanging out with us and answering all our questions.
Yeah, you're welcome.
There was one question. I wanted to keep this one to the end. Where are you guys located?
Scottsdale, Arizona, and Gilbert, Arizona. We're just in the state of Arizona currently, but I do have friends that have a ketamine clinic in Palm Spring, Reset Ketamine. Dr. Sam Coe, fantastic clinic as well. Dr. Sarah Herman, she's in the San Francisco area, Menlo Park, Soft Reboot Wellness, also a fantastic practitioner, anesthesiologist and ketamine provider. And there's plenty other ones out there as well. So if you're in a different state, I most likely know someone that might be closer to you because we go to something called the ASKP, the American Society of Ketamine Physician Conference, every single year. So we're connecting with ketamine practitioners around the country. And so if there's one you're not here in Arizona, I can likely help you find a place.
Come visit us for 2 weeks.
Or come visit us for 2 weeks, yeah, medical tourism.
It's the amazing heat. It's amazing.
Best time of the year.
Come in July. It's the best then.
Yeah,
no, seriously, come out here. It's great. We have patients who fly out here just to do treatment frequently, and worth it. Like we said, you can't put a price on your health and your well-being, and you can't put a price on these lifetime changes.
Yeah, 100%. Yeah, medical tourism is a thing. I go understand 2 or 3 weeks coming out would be a long time away from family and whatever someone's circumstance is. But you could always come here and do the initial induction series, learn your dose, learn the process of integration, how to do it, and then find a local ketamine clinic near you. And I would be happy to discuss your treatment with them and come up with a plan and try to make it as similar as possible if you find what we've done has really helped you.
Yeah, and I never shared the location or the name of your clinic for, I didn't want anyone to know where I was, obviously, for safety reasons. But now that it is called Advanced Wellness and Pain, if you guys want to Google it, I will also tag all their socials and everything when I post this live on my page. So you guys will also be able to get a hold of them there.
Yeah, not to confuse you guys, we also now, from a marketing standpoint, we do business as Phoenix Scottsdale Ketamine Therapy Clinic for our Scottsdale location. And then this clinic is Gilbert Chandler Ketamine Therapy Clinic, but our website is advancedwellnessandpain.com. On Instagram, we're psychedelic_DRS. Reach out in the DMs. I'm happy to answer questions. Unless I get blown up, then I'll have to take some time. I do have a child and a wife outside of this. So, but we're here for you. We're here to help you, and really appreciate this opportunity, Adriana, to speak to your following of people and helping people that are navigating challenging times in their life. There is hope. Do not lose hope with yourself. The comeback is greater than the setback. Okay, it's really important to remember that.
And I'll say this too. I work here. I don't own this. I don't have any skin in the game other than I truly, truly believe in what we are doing here. I could probably go somewhere else and make more money, but I believe in this, and it has changed my life, and that is why I do it, and that is why I'm sitting here right now. I'm not getting paid to do this. I am sitting here because I believe in this, and it has drastically changed my life. I was somebody who had no hope. If you had known me 2 years ago, you wouldn't recognize who I am today because of this treatment and because of the perspective change. So it's something I'm passionate about.
I appreciate that. You're an integral part of this process, Marilynn. So, thank you. I'll put it on record. We appreciate you. We love you. Thank you so much for being a part of this process with us. She's usually here Monday, Wednesdays, and Fridays. And then us 3 doctors do rotate through our 2 clinics. So there's some variety on who takes care of you, but there's always a doctor present. And then we do have integration coaching, and so you'll have the same coach the whole time. So there's some consistency there, as well.
Yeah. Alrighty. Okay, guys, I don't see any more questions. So like I said, I will post this on my page. Thank you guys again for answering all our questions.
You're welcome. Honor and privilege. Take care, guys.
Bye, guys. Let me flip this around. Okay. Like I said, I will also be posting a video letting you guys know my experience because I know you guys have been asking me questions about that. So I'll do that at a later date. But thanks for joining us. I don't know how to shut this off since it's
your first live.
Time, my first live. Do I just hit live? I don't know. Oh, exit. Okay. Bye, guys.